To connect employers with qualified, skilled talent and job seekers with employment and career development opportunities. Tune in the first and third Wednesday of each month at 9:30 a.m. to Career Source, Citrus, Levy, Marion, and learn how they can help you.
Ocala's information station, 1370 WOCA. Ocala!
Just about 10 minutes after 11 o'clock. Thank you for tuning in. There are so many different things happening in our world. Every time you turn around, there's something new. You know, I think when we were predicting what would the future be like a few, maybe 10 years ago, 20 years ago, we probably had it right, but we had no idea how quickly things were going to change. And that's not just technology, but that's also in medicine and transportation and everything. So as we progress in learning how to deal with things, we also discover new diseases. So it's like nature just doesn't want to give us a break, right? There is something now called, and maybe it's not new, it's just new to me, Hashimoto's Thyroiditis. It's described as the health-wrecking autoimmune disease that every woman needs to know about, Robin. You need to pay attention.
I'm all ears.
Yeah, all right. Dr. Jeffrey G. Garber is going to fill us in on this. He is the chief of the endocrinology division at Harvard Vanguard Medical Associates. He's a member of the Beth Israel Deaconess Medical Center and Brigham and Women's Hospital endocrine divisions in Boston, and a thyroid expert. It goes on and on and on, lots of credentials. And Marnie Goldberg is a YouTube beauty and lifestyle vlogger and a patient with Hashimoto's thyroiditis. She was a teacher at an elementary school, a reading specialist, and so many credentials on her list also. Let me just stop talking and say good morning to Dr. Jeffrey Garber and Marnie Goldberg. Good morning to both of you.
Good morning.
Good morning.
Thank you for being on the air with us today.
Thank you for having us.
Are you both in Boston?
That's where we're sitting.
That's where we are. Okay. I'm just visiting.
We're sitting in a Boston suburb.
Oh, okay.
And I live here.
Okay.
And I'm visiting from San Antonio, Texas.
Oh my gosh. Okay. So Marnie, let me start with you. When you first started getting symptoms, what were the symptoms?
Well, the important thing to note is that I didn't realize they were symptoms for almost a year. I thought it was just getting older. I was extremely tired. I would wake up tired and be ready to go back to bed. About 2 hours later, I gained a significant amount of weight in a short amount of time. But what got the attention of my husband and what ultimately led to me making an appointment with my doctor was the changes in my temperament. I was moodier than usual, more irritable than I think anyone should need to put up with, and I couldn't concentrate on anything. So he mentioned that maybe there was a medical reason for all of these things happening at the same time. Wow. And that's what led me to make that appointment.
Wow, that's pretty smart. And so
he's a pretty smart guy.
So, doctor, do the symptoms that Marnie just described, are they common?
Yes, they're common in people who have an underactive thyroid, and they're common in people who don't. But the lesson you learn is that if they're new to you, they need to be explained, especially if you can't explain them. If it isn't just 3 to 4 months of bad sleep or some other basis for it, it needs to be explored, because lo and behold, it may be your thyroid.
So can I ask you to do like Thyroid 101? What is the function of the thyroid? What does it actually do?
Well, first off, it's a small gland located at the base of your neck, and it affects the way your body's metabolism works, which is the way your body produces energy. Every one of our tissues and organ systems needs energy. So when you don't have enough thyroid hormone, you lack that, and starting from the most general to some specific things, you can be just flat out tired, your mood can be depressed, you can be cold when others are warm, your bowels can be sluggish, your muscles can ache, you can really, virtually anything you can think of that can go wrong fits the potential spectrum. And again, the trick is to sort of know that it's different for you. And with Hashimoto's thyroiditis, and by the way, we talk about things being new, Dr. Hashimoto described it in 1912, so I guess we're just catching up with it. So if you have and it is an autoimmune disease where your body's attacking tissues in that it doesn't recognize as belonging there, and it runs in families, and there are other autoimmune conditions you can have in the same families. So that's basically the 101 of it is, if the thyroid is affected by Hashimoto's thyroiditis and it's advanced enough, it can become progressively underactive and create those symptoms through a lesser and greater degree.
Really? So is the disease attacking the thyroid itself?
Yes.
Okay.
You develop antibodies just the way when you get vaccinated against certain critters, you basically destroy them when they're in sight. And in this case, your body is off. It's attacking your own thyroid.
Oh my God.
And there are antibodies in the blood that you can measure. In fact, that's how most of the diagnoses are made, by a blood test for the antibodies, in addition to thyroid hormone levels, which diagnose hypothyroidism. Another feature that can lead to the diagnosis, and often is the tip-off, is that the gland that's inflamed often enlarges and gets characteristically firm, irregular, and it can be felt by an experienced physician. And
really?
That can lead to a test, yeah.
So could you feel it at all, Marnie? Could you feel it? Oh, like, could you touch your neck and feel it, or no? Is it too deep?
Well, I mean, a physician can touch my thyroid. I mean, I am not trained to exactly know what it is I'm touching under my skin, but no, mine is not, thankfully, not enlarged.
Okay.
I don't have anything palpable that you can
We're all
feel
touching our
from a
necks right now,
physical
by the way.
exam.
That's right.
We're all touching our necks. All right.
Just make sure you touch it in the right place.
When a person has this and you say that attacks the other parts of the body, does it also affect the reproductive system? Or if
It's
you're
a great
trying
question. There are two parts to that. First, when your thyroid is underactive, your reproductive system won't work. You can lose your periods. You can be infertile. It can be a problem. Even if you're mild, it can become more severe during pregnancy. Also, there's an autoimmune condition called premature ovarian insufficiency or premature ovarian failure, where women get early menopause. And it's a cause of infertility, and sometimes it's reversible if it's just thyroid hormone, and sometimes it's just an early menopause. So the answer is yes in two different ways. Fortunately, the premature ovarian failure is relatively infrequent, but the menstrual irregularities and the infertility that's rapidly reversed with thyroid hormone is relatively common. And all infertility specialists and gynecologists and endocrinologists are aware of this. So it's another thing to bring to the attention of your doctor when you have these symptoms, that your periods might be off, the bleeding pattern might be different.
And if you're a man that has been diagnosed with thyroid disorder, does that also affect their ability, their reproductive system, their sperm count?
Generally, not in any striking way. There is an equivalent in males. It's much less common. But if you sort of step back and think about reproductive function and sexual health, being tired is about as important as a feature to mess things up as you could imagine.
Yep.
So the global question and the, to cut to the chase, is if you can't get out of bed, there are other things you can't do.
That was probably what brought it to my husband's attention more than any of the other symptoms, if we're going to be.
Yeah, I can understand that.
Yes.
So you were tired, and that's how and you got grumpy because he was trying to wake you up? Is that what happened?
Let's just say that if I was in bed, I wanted to be sleeping.
Is this adult radio? I just wasn't
Yes,
sure.
it is. Yes.
Okay, good.
Sorry.
We have a sophisticated audience. We're good.
Good.
No, but I mean, I was trying to figure out. I mean, before we even went down that path, I was trying to figure out what exactly causes the personality change that you described earlier, being irritable when you weren't always that way. And I guess the best explanation is that if you want to sleep, you want to sleep, and so the irritability is kind of a side effect. Am I figuring it out right? Am I right?
I think it's as profound and as simple as that. If we all got progressively sleep deprived, and then if we got enough sleep and we pooped out anyway, it's a double whammy. It's not at your best, you're bad.
So if we were to ask you to describe exactly how you help somebody with this condition, doctor, it probably wouldn't serve us a whole lot because we're not doctors. So what we really need to know is how to identify it and what to do and maybe what to expect. So you've kind of helped us learn how to identify it, or at least how to kind of have a red flag go up. But what should somebody expect if you've been diagnosed with this, with Hashimoto's thyroiditis, and you're being treated? Do you expect it to go away overnight? Do you expect it to take a year? What's the expectation?
I think weeks is reasonable, and there are some aspects of the condition that take a long time to recover, like profoundly dry skin, but energy and other things respond much more rapidly to it. And generally speaking, you should be back to where you were when you started.
Okay.
And if not, you need to look, and for more information, you can go to thyroidawareness.com, which is our website. That's one word, thyroidawareness.com.
That's the good information to keep with us. We'll make sure we mention that again. So, Marnie, did you make a full recovery very quickly? Did you notice results right away? What did you do to get those results, too?
As soon as I started treatment, within a matter of weeks, I was feeling back to myself again. It took a little longer to lose the weight, but I stopped gaining weight, and things got back to normal pretty quickly.
Well, the thyroid is often pointed to as a reason why we gain weight. Do we use that as an excuse too often when it's not even true? It sounds like it was in your case. But what is the truth with that?
Well, the truth is that in the years back, that people got so profoundly hypothyroid for a long time that mainly they got essentially waterlogged. Nowadays, it's just associated with modest, not trivial, but modest weight gain, and a more common complaint is the inability to lose weight rather than substantial weight gain. But that old history of the thyroid being linked to weight is imprinted on basically the public. So it's part of the deal, but it's not profound, generally.
Is this condition hereditary? Marnie, are you afraid that your children might have it?
It is definitely associated with, it's an autoimmune disease, so it is associated with, it is a hereditary condition, but we need to jump on another interview, so I'd really encourage your listeners to get more information on our website, thyroidawareness.com. There's all kinds of information, not just about hypothyroidism, but all sorts of thyroid disorders as well.
Okay. All right. Well, we'll take that website and use it. Thank you both for being on the air with us today. I'm glad you're doing better, Marnie.
Thank you so much.
Thank you.
All right. We'll be right back. This is The Source, WOCA Ocala.
On this episode